Doctors on Air, presented by Lake Cumberland Regional Hospital. And this morning we have calling in Dr. Ausaf Ahmed from Lake Cumberland Regional Hospital. Good morning, doctor.
Hey, good morning.
You are a doctor of neurology at the hospital, and we are going to talk about stroke this morning. So when we say the word stroke, Dr. Ahmed, what are we talking about when it comes to that happening to your body?
Sure. So in basic words, stroke is something which relates to brain and its vasculature. It could be something in which your vasculature collapses and cannot give you enough blood to your brain, or it's a burst of your vessel pipe and a bleeding in your brain.
Mm-hmm. And May is Stroke Awareness Month. And Dr. Ahmed, we hear sometimes about people having a stroke, but they didn't know that that's what they had. They didn't know that was what was wrong. What are some signs and symptoms of a stroke that might be coming or that you may have had one?
Sure. So honestly speaking, a stroke could be so vast that you cannot cover all the symptoms and signs of a stroke. But there's a word which you have to remember when you're looking for a stroke. It's a short term which you can see everything which you need to know. It's called be fast. And be fast stands for that you have to be aware of balance, E for eyes or vision being affected. If you have face being affected, that one side of the face looks different than other, one arm is weaker than another, or you have speech problem. And the T for the fast is basically time. The time of noticing these symptoms and going to the hospital is a very crucial thing in management of stroke. So for all who is listening, just use this word, be fast, look at the balance, eyes, face, arm, and the speech.
Yes. Dr. Ahmed, are there certain age groups that are affected more by stroke or certain genders that are affected more?
Yeah. So middle-aged males, postmenopausal women, and elderly patients are more likely to have a stroke or any complication related to stroke. The patients, those who are younger, it's less likely to have stroke, but because of growing morbidities like obesity and diabetes, these things are becoming much more common in younger patients too.
Are strokes hereditary? Do we see it passed down through genetics? Does that cause a stroke or can?
Genetics do play a certain role. Most of the time, the stroke caused by a genetic mutation with the clotting disorders are very rare, but that can be one of the part of it. Most commonly, most of the things which causes stroke are your lifestyle, like smoking, diabetes, hypertension control, sedentary lifestyle, too unsaturated fat in your diet. So that plays a major role than the genetics.
And doctor, that was actually my next question to you. Are there lifestyle habits that we can change and alter and be better at to prevent a stroke from happening?
Yeah, so for sure, the diet plays a major role. It has shown that if you are using olive oil, it is very good for your cardiovascular health instead of using a regular oil. A sedentary lifestyle is much more harmful. It has recommended that you do 30 minutes of exercise 3 days a week at least to prevent stroke or heart attacks. There's a diet called DASH diet. It's DASH diet, and you guys can always go in the internet and search what DASH diet is. It actually gives you a very good balanced diet to prevent these complications from happening.
And you said that is DASH, DASH, right?
Yes.
What if someone has had a stroke, either knowing or not knowing, but realizing a stroke has been had, and they come to the hospital for care? What do you do for the patient at that point?
Sure. So it really depends when they are coming to the hospital.
Mm-hmm.
So a patient who is coming to the hospital within 3 hours window, they are the most likely to benefit from the treatment. There's a clot-busting medications which we can give for a stroke, and it has a time window where we can use it. There are some procedures which can be done within 12 to 24 hours of presentation. If the patient is coming beyond that time, the damage is usually persistent. Then we actually focus more on recovery part of it and doing investigation that what might have caused the stroke so we can prevent it from happening in future.
And I know, Dr. Ahmed, all strokes are different, but can people recover from a stroke, especially if they get to you in time?
Yes. So if they receive a clot-busting medication, there's a 16% chance that they actually have a very good recovery to the point that they can function in a normal way, the way where they're doing before. Some of them recovers but leave behind some sort of deficit. Even if you have missed that time window of management, the rehab facilities do help you recovering and gaining back the strength. So there's always hope, and just don't ignore symptoms of stroke. The worst thing is to think that it's a small stroke and ignore it, because the next stroke can happen, and that can be more devastating. And the risk for that is first 90 days.
First 90 days.
Yes.
And doctor, we always like to ask all of our doctors who take the time to call into the show, from your seat and perspective as a doctor, how important is it that people get a primary care physician and go to the doctor, get their checkups, get their screenings, check their mind so that we can all stay healthy?
It's extremely important. And as I said, the lifestyle modification, in the same way, there are comorbid conditions, which if you know from before, and the only way it happens is if you have a primary care physician. So if you have hypertension, the only way you would have the blood pressure checked if you have a primary care physician and taking care of it. So blood pressure issues, heart issues, the diabetes, these are all issues which end up to a stroke. So if you have a good primary care physician who is taking care of you and you're being compliant to his recommendations, you're basically already reducing the risk of having a stroke.
Yes, so there's lots we can do with our lifestyle to prevent possibly